I'm Dr. Katouf, and I'm going to present trigeminal neuralgia and other trigeminal neuropathic pain. First, starting with the definition of neuropathic pain, which is defined as a pain initiated or caused by primary lesion or dysfunction in the nervous system. Neuropathic pain could be precipitated by nerve injury or disease and can exhibit both positive and negative sensory phenomena. Neuralgia is defined as pain in the distribution of nerve, and it's described as a recurrent sharp stabbing or electric shock-like quality pain in the area innervated by the nerve involved. And neuralgia named according to the nerves involved. Trigeminal neuralgia is the most frequently diagnosed form of neuralgia, which is a painful condition affecting the face and the distribution of one or more divisions of trigeminal nerve. Average age of onset is usually 50 years old, and it affects female more than male. The International Classification of Headache Disorders, 3rd edition, classified trigeminal neuralgia into classical trigeminal neuralgia, secondary trigeminal neuralgia, and idiopathic trigeminal neuralgia. And the diagnosis criteria include at least 3 attacks of unilateral facial pain fulfill criteria B and C. Criteria B include occurring in one or more divisions of trigeminal nerve with no radiation beyond the trigeminal distribution. Criteria C include pain has at least 3 of the following 4 characteristics: recurring in paroxysmal attacks lasting from a fraction of a second to 2 minutes, severe intensity, electric shock like shooting, stabbing, or sharp quality, precipitated by innocuous stimuli to the affected area. The etiology could be idiopathic, traumatic, compression of the trigeminal nerve by neuroplastic or vascular anomalies, and demyelination conditions. It can be related to multiple sclerosis or a similar disorder that damages the myelin sheath protecting the certain nerves. Clinical cases can be classified into 2 groups: classical trigeminal neuralgia and secondary trigeminal neuralgia. The differential diagnosis between the 2 type of trigeminal neuralgia. By clinical guide, no clinical features have a high sensitivity for identifying patients with secondary trigeminal neuralgia. Patients with secondary trigeminal neuralgia seem to be younger than 50 years old and more likely having trigeminal sensory deficit and bilateral pain, caused or attributed to space occupying lesion, MS, or attributed to other disorder, and involving of V1. However, the absence of these features doesn't rule out secondary trigeminal neuralgia. So based on a low evidence, no clinical characteristic can exclude secondary trigeminal neuralgia. The diagnosis depends mainly on the description of the pain, which include type, location, and triggers. Clinical examination include cranial nerve examination, general sensory testing of trigeminal nerve V1, V2, and V3 branches, analgesic blocking with lidocaine. Investigation include MRI and MRA. Differential diagnosis of trigeminal neuralgia to rule out odontogenic pain, glossopharyngeal neuralgia, nervus intermedius, and SONA or SUNCT. Treatment for trigeminal neuralgia include medical management, and for medical management there is a range of anticonvulsant medication in which carbamazepine and oxycarbamazepine the most effective for classical trigeminal neuralgia, but due to their side effects, and sometimes the patient can't tolerate these side effects, they changed it to the second option of anticonvulsant, which include gabapentin and pregabalin, which have less side effect. Also, we have another list of medication that we used for management of trigeminal neuralgia. And in case the medication didn't work, surgical management will be the other option. Coming to the peripheral neuropathy. So peripheral neuropathy is a result of damage to the nerve outside the brain and the spinal cord. Trigeminal peripheral neuropathy created pain and or numbness in the distribution of trigeminal neuralgia. And topical agents is used for management of peripheral neuropathy, in which using of lidocaine 5% plus capsaicin, also sometimes using of compound medications. So this animation will illustrate the mechanism of action of peripheral neuropathy. Also illustrates that the treatment of peripheral neuropathy, in which using local anesthesia and capsaicin. So if pain in the treatment area reduced significantly with lidocaine, topical or local anesthesia and filtration, an acrylic stent can be made as shown, and we can put the specific topical medication in the stent to relieve the pain. Thank you.